2025, call-in of the future of council-operated dementia care home provision, Castle Grange and Claremont House. Sorry. I will now ask Cllr Andrew Cooper, as spokesperson for the signatories, to outline the reasons for calling in the decision made by Cabinet on the 10th of December 2024. Thank you.
Okay. Andrew Cooper, I'm a councillor for the Newsham ward. In our submission, proposing a call-in of this Cabinet decision, we sought to show the Cabinet had not properly considered all the factors that led to the decision, or were not furnished with the information they needed to come to a decision. The Cabinet member is on record as saying that she is gutted to be pursuing the privatisation of these homes, and I will seek to show that this decision should be reconsidered in the light of the evidence. I'll start by making the point that since this proposal was first floated, the Council has been provided with additional, unbudgeted for millions as part of the local government settlement, which should more than provide the flexibility needed to abandon these proposals. No proper consideration has been demonstrated assessing the risks of transferring the homes to the private sector, given the huge instability caused by the rise in national insurance employers' national insurance contributions. Families have been excluded from meaningful discussions with details withheld under commercial confidentiality. Concern about increased costs, continuity of care, and potential closures remain unanswered. Families fear steep fee hikes and third-party top-ups, making care unaffordable and risking forced relocations that could severely harm residents. In the Cabinet report of the 10th of December 2024, the Council acknowledges the family's concerns, namely, there was concern that the homes may not remain as dementia care homes. Families are interested in knowing what, if any, restrictions will be in place to mitigate the immediate changes to the service. The Council's response was as follows. They, the families, have also been advised of the confidential nature of the procurement process and that a limited amount of information can be shared with them at this time. For the families, that is not satisfactory or at all reassuring. Families are very complimentary about the excellent and high-quality care currently received by residents at both homes. Concerns were raised about whether the quality of care will be maintained post-transfer to a private provider. The Council's response was to suggest that the homes will be overseen by the contracts team, which deliver proactive, targeted support in partnership with the NHS and other key partners around improving the quality of care to regulated care providers in the borough. Critically, however, they say staffing levels will be at the discretion of the new provider, and that will have a direct impact on the quality of care. Families are extremely concerned about the potential increase in the costs of care and the possibility that top-up fees will be introduced. The Council's response was, any increase in fees will be at the discretion of the new provider. The Council will continue to contribute to care costs for low-income residents based on the outcome of a financial assessment. The families have stated clearly their opposition to this proposal and are keen to know what will happen should a suitable provider not be found. The Council's response is to indicate there is no alternative to a private provider, since doing nothing is not an option, and they have once again raised the prospect of closure. This is despite families being told by senior council officers following the rescinding of the previous closure notice that the homes would be safe for the next 3 to 5 years. There has been a lack of transparency over the financial rationalisation for privatisation. The report of the 8th of October gave estimated savings of 1.2 million to 2 million. But for the 10th of December, this was reduced to 0.8 million. No really detailed explanation was given for this reduction. Both of the Cabinet reports from the 2024's privatisation proposal have stated only stated figures from the full financial year 23-24. And last year's finance presentation and Cabinet report stated figures based on the same year's budget, but no actuals. None of the reports across both attempts to dispose of the homes from reference data for any other year. Castle Grange costs were around 418k over budget, but Claremont House was only very slightly over by 5k. But no explanation has been provided for this overspend, or why one home is significantly over while the other has met the budget. There are some real concerns about the income data. Based on the Freedom of Information request submitted on the 5th of November 24, income that the council was owed amounted to 730k for an average occupancy rate of 57%. Scaled up to full occupancy, the owed income could amount to almost 1.3 million per year. The homes have been only operating at 57% occupancy, meaning more income should be generated by filling the homes. The homes were left unfilled due to the Cabinet decision in December 2023 to halt all new entrants during the closure proposals. Why was almost half of the staff budget spent on Reed specialist recruitment, which is expensive? This is an inefficient use of money and in terms of using agency staff. And was this due to the uncertainty over the home's future? So 23-24 was not a normal year on which to base a decision over the home's future. The Cabinet decision is financially unnecessary. The case is unproven and not in the best interests of residents or their families. And the decision should be referred back by this panel to Cabinet for them to look afresh at the financial case behind the decision, and for them to consider what privatising these homes says about their values and about a council service that is valued by residents and their families.